Health officials in Quebec are sounding the alarm over community spread of measles. The province says there are now 7 cases in Quebec, with 3 of those linked to international travel.
We think that it's a beginning of a transmission inside the community. We are kind of worried about the evolution of measles inside our community.
Nearly a dozen cases of measles have been confirmed in Canada in the past 2 months, compared to a similar number for all of 2023. Canada's top doctor, Theresa Tam, is urging Canadians to be up to date on their measles vaccination as rates of childhood vaccines against the virus are tumbling. And joining us with more on the measles is Dr. Earl Rubin. He is the director of the Infectious Diseases Division at the Montreal Children's Hospital. Dr. Rubin, thanks so much for joining us this afternoon. How
My
concerned
pleasure.
are you now knowing that there are 7 confirmed cases of measles in the province of Quebec?
Very concerned. In your introduction, you talked about 3 that were acquired overseas. What concerns me much more are the 4 that were not. Those 4, as far as I understand it, have no epidemiologic link to each other. So it's not like there are 3 or 4 siblings from the same household. They are distinct communities, different communities, and in theory have no contact with each other. So it really is just the tip of the iceberg, because where did they get it? From whom? And who are that person that they got it from? To who else are they spreading it?
What's the process like right now? Are they doing contact tracing with these individuals?
Absolutely. I can tell you I was at the hospital till 1 a.m. doing that. That what we do when we have a suspect case is we isolate and we test. When we have a confirmed case, we start to do contact tracing. And so I don't know if you'll be asking about how infectious this is. It probably is the most infectious disease illness that we know about. It doesn't take much if somebody is non-immune. So the contact tracing is very broad, coming back to your question. As an example, if somebody is not immune, meaning they've never had measles, which likely they never have had, and have not been vaccinated, if they are in the same airspace for even a few minutes, it is potentially communicable to them. And more so, if somebody actually has measles, is in a room and leaves that room and somebody enters it within an hour or 2, they can still get it because it's airborne, and depending on the number of air exchanges for the room, it's hanging about. And so it is very contagious, and that's where the vaccination issue becomes incredibly important.
Mm-hmm. What can you tell us about who might be the most vulnerable to measles?
So for sure, the morbidity and mortality, meaning the bad effects of it or even death rate, is higher amongst children, but adults are not out of the woods. The people who are not vaccinated, pregnant women also get more complications if they're not vaccinated. The immune compromised, so even if they are vaccinated, they may have lost their immunity, or if they have some, their immune system can't mount an adequate response. So around the world, and traditionally, it was really young infants and children that were most affected, but adults potentially can suffer consequences.
Mm-hmm. Actually, what about the risk level to those young infants that you just mentioned? You know, they may not have been immunized yet. What does that look like?
So it really has to do with, are they at risk? Everybody under 11 months has not been vaccinated. We start the vaccination at 12 months. It's having been in contact and not immune that we worry about. Public health and the healthcare facilities will intervene depending on the timing by giving an injection of antibodies to prevent, we hope, the infection or at least modify the illness. And if it's within 3 days of having had a contact and the baby is over 12 months or a child or an adult and they're not immunized, we will intervene with the vaccine because it takes time to have the manifestations of the illness. And hopefully, if we give the vaccine early enough, within 72 hours, we may be able to modify the disease, if not prevent it.
And what about those booster shots? Are those ones that are received by those school programs, or how do children, at what ages do they need to be getting those taken care of?
So we don't really do boosters with MMR. Every province has different timing in the United States, but generally speaking, the doses are given the first dose after 12 months of age. And the second dose, the schedule varies as long as it's after 15 months of age. And the two doses together, regardless if as long as you've had that timing, two doses together is about 97 to 98% effective to prevent illness. A single dose after a year of age is about 93% effective. So if you've received the two doses, there aren't boosters like the tetanus boosters, the COVID boosters. That's not what we do. But certainly we do intervene, especially as numbers are increasing, to make sure that people are vaccinated. And if they haven't, to bring them up to date.
Dr. Rubin, thank you again for your time on this. We really appreciate that. Dr. Earl Rubin is the director of the Infectious Diseases Division at the Montreal Children's Hospital.